other equipment, check medication order against the original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. Note the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medications to be administered. Consider the appropriateness of the medication for the patient. Perform hand hygiene. The medication cart to the outside of the patient's room, or prepare for administration in the medication area. Unlock the medication cart or drawer. Enter passcode and scan employee identification if required. Prepare medications for one patient at a time. Medication administration record and select the proper medication from the patient's medication drawer or unit stock. Compare the label with the MAR, check expiration dates, and perform calculations if necessary. Enter the barcode on the package if required. Prepare the required medications. Unit dose packages. Place unit dose package medications in a disposable cup. Do not open rubber until at the bedside. Keep narcotics and medications that require special nursing assessments in a separate container. For multi-dose containers, when removing tablets or capsules from multi-dose bottle, pour the necessary number into the bottle cap and then place the tablets in a medication cup. Break only scored tablets if necessary to obtain the proper dosage. Do not touch tablets with hands. For liquid medication in multi-dose bottle, when pouring liquid medication in a multi-dose bottle, hold the bottle so the label is against the palm. Use the appropriate measuring device when pouring liquids, and read the amount of medication at the bottom of the meniscus at eye level. Wipe the lip of the bottle with a paper towel. When all medication for one patient have been prepared, recheck the label with the MAR before taking them to the patient. Replace any multi-dose containers in the patient's container or unit stock. Lock the medication cart before leaving it. Keep the medications in sight at all times. Ensure that the patient receives the medication at the correct time. Identify the patient using the 3 methods and compare information with the MAR. Check the name and identification number of the patient's identification band. Ask the patient to state his or her name. If the patient cannot identify him or herself, verify the patient's identification with a staff member who knows the patient for the second source. Complete necessary assessments before administering medications. Explain the purpose and action of each medication to the patient. Assist the patient to an upright or lateral position. Administer medications. Offer water or any permitted fluids with pills, capsules, tablets, and some liquid medications. Ask whether the patient prefers to take the medication by hand or in cup. Remain with the patient until medication is swallowed. Never leave medication at the patient's bedside. Perform hand hygiene and leave the patient in a comfortable position. Check on the patient within 30 minutes or time appropriate to drugs to verify response to medication. Then finally, document the procedure in the patient's chart.